Hi, welcome. Today we're going to learn more about the skeletal system. Now I had some issues with my headphones, so you might hear a little background noise in this video, and I apologize if it comes through. Before I start on the skeletal system, I just want to do a quick check-in with you and see how you're doing with your study habits and exam prep. At the beginning of this semester, most of you did an ed puzzle on academic skills, and you had to write some ideas and activities you would do when you studied. Have you been doing them? Has it worked out for you? Think about the things that you said you would do, and are they working? If they worked and you were prepared, then good job. Keep up the good work. If not, it's time to change it now. There are some things you can do that can give you a better chance of being successful. One thing is to read before you watch the lecture ed puzzles. Reading helps the information get in your brain so that it's there as I do the lecture, it adds to it. You never want your lecture to be the first time you're hearing something. We know that new knowledge sticks to old knowledge. So simply reading through the chapter, even if you don't understand it, helps prepare your brain so that you can remember it better when you watch the lecture. After lecture, rewrite your notes. When you rewrite your notes, say things out loud. Cover up your notes. See if you can repeat it and say it back without your notes. Answer questions on that exam review sheet every week. Take practice quizzes and use the dynamic study modules. They're very helpful. The more you practice, the more you'll be able to learn and remember, and it will also help you zero in on any areas you need to spend a little more time on. Use the Mastering A&P resources. The study area has a lot of terrific tools. The best way is to teach someone or something the material. Draw things out. Talk about it. If you can explain it, you know it. If you need help creating a detailed weekly schedule, ask. I don't bite, and I would love to help you with it. Now, just a quick note, remember when you read, I want you to read just a little bit on what that particular lecture is on. So use your checklist to help you see that. Okay, let's jump into the skeletal system. So we learned systems in chapter 1, and you probably remember the skeletal system are the bones of your skeleton. And we have two types of bone. We have compact bone and spongy bone. And spongy bone goes by the name of cancellous bone. So two types of bone tissue. Cartilage is also part of the skeletal system. The two main types of cartilage in our skeletal system are hyaline and fibrocartilage. Now you might remember that hyaline cartilage forms the costal cartilage, and this is the cartilage that connects your ribs to your sternum. It also forms articular cartilage. And remember, articular cartilage is the cartilage that's on the ends of bones at joints, whereas fibrocartilage is in those intervertebral discs and in your knee. Now, ligaments are the connective tissue structures that stabilize your bones. And remember that ligaments are dense, regular connective tissue, and they are going to join two bones together, so they connect bone to bone. So why do we have a skeletal system? Well, number one is pretty obvious, right? Protection. It protects things like our brain. Your brain is inside your cranial cavity. Your heart and lungs are protected by the bony thorax. Your vertebral cord, your vertebral column, protects your spinal cord. So obviously protection. It's also a mineral storage area. The main minerals that are stored in our bones are calcium and phosphate. Now, calcium is super important, and we'll learn more about that later, but our bones become a reservoir for calcium, so if any time our blood calcium levels decrease, we can take calcium out of our bones. Bones are responsible for all blood cells formation. So you probably remember there's three types of blood cells. What are the three types of blood cells? Red blood cells, white blood cells, and platelets. Now, all of these are made in marrow called red bone marrow, and that process is called hematopoiesis, or you might hear it pronounced hematopoiesis, and that's the process of forming all blood cells, so it comes from your bone marrow. Now, we also store fat. So bones store fat. Remember, fat is adipose tissue, and fat is found in yellow bone marrow. So yellow bone marrow looks yellow because lipids often look yellow, and that's going to store the triglycerides or the fat. And so we're going to see that in the yellow bone marrow. Obviously, bones are critical for movement. Muscles attach to bones through tendons, and when muscles contract, they move the bone so we can move. And then support. Our skeleton supports our body weight. Now, there's different ways of classifying bones. Most bones in the body are long bones, and it's probably what you think of when you see a bone. A long bone is longer than it is wide. And so again, this is a humerus in this picture, your femur, right, your tibia, radius, and ulna, even your phalanges. Each phalanx is a long bone. Now, another type of bone is a short bone, and a short bone is basically as wide as it is long. And the best example of the short bones are the carpals, which you know are in your wrist, and you may know that the tarsals are in your ankle. A flat bone is just what it sounds like. It's flat. So the sternum is a great example of a flat bone. Also, most bones of your cranium or your skull are flat. Irregular bones just don't fit any other category. They have a weird shape, and a really good example of an irregular bone would be vertebra. And then a sesamoid bone is a bone found inside a tendon. And the patella, which you formerly call it your kneecap, is a sesamoid bone. It's the largest sesamoid bone in the body. But we have sesamoid bones in our hands and in our feet, and that can vary in number between individuals. So let's look at the gross anatomy of a typical long bone. So remember, gross means what you can see with the naked eye. And if you look at a long bone, you'll see this long piece here, which is the shaft. And the shaft is known as the diaphysis. So this whole thing is the shaft. Inside of it is a marrow cavity. It's hollow inside. So it's called the medullary cavity, or we also call it a yellow bone marrow cavity, or sometimes they just call it a marrow cavity. This is where you find the yellow bone marrow. So inside the diaphysis of all long bones is fat. Now, the two ends of the bone are the epiphysis. So an epiphysis, there's two of them. So one's going to be proximal and one's going to be distal. Remember, proximal means it'll be closer to the point of attachment. The epiphyses, that's the plural form, have red bone marrow. And remember that red bone marrow makes all the blood cells. You will also notice some hyaline cartilage here. Now, often hyaline cartilage is colored light blue. Seems to be like a common color that most illustrators use. And so you can see the hyaline cartilage on the ends of the bone, on the ends of each epiphysis. And that's articular cartilage because it's lining and lubricating and reducing friction where the two bony surfaces articulate or meet. And then you'll have this little area in here between the epiphysis and the diaphysis, and it's called the epiphyseal plate or epiphyseal line. Now, we're going to talk more about that later, but the epiphyseal plate is a layer of hyaline cartilage, and it's also known as the growth plate. So while you're actively growing, you have a layer of hyaline cartilage. Once you've stopped growing, it becomes the epiphyseal line. If we cut the bone and look inside, remember I told you the inside was hollow. It's lined with endosteum. Endo means within. And there's something called a periosteum, which surrounds the outside of the bone, and peri means around. So this isolates the bone. It's a passageway for blood and nerve vessels, and it actually lines the whole outside of the bone all the way down to the joint capsule. You might remember, do you remember what kind of tissue the periosteum is? Hopefully you're saying dense, irregular. So it's another connective tissue, dense, irregular connective tissue. And you can see how it's attached to the bone through these things called perforating or Sharpie's fibers. So that periosteum is really anchored onto that bone pretty tight. In fact, the muscles and the tendons insert on the periosteum. So every time a muscle contracts, it's pulling on it. Sometimes overuse injuries can pull that periosteum away, and this is a common cause of shin splints. So if you've ever had really bad shin splints, that's what's happening there usually. If we look at flat bone, I like to call flat bone a spongy bone sandwich because you've got all this spongy bone or cancellous bone inside, and then you always have compact bone on either side of it. And so your flat bones are going to have a lot of red bone marrow. In fact, the flat bones, the short bones, and the irregular bones all have the same structure where they have that compact bone on the outside and inside is all that spongy bone. So we know that blood is vascular. It has its own artery and vein. It's just called a nutrient artery and vein. We know that blood also is supplied with lymph vessels and nerves. If you've ever broken a bone, it hurts. And so we're coming back to the bone marrow again. And remember, there's two types. There's red bone marrow, and red bone marrow, remember, is found in the epiphysis of a long bone, but it's really plentiful as well inside a flat, short, or a regular bone. And we look at this red bone marrow because remember, this is where the blood cells are made. So hemopoiesis. The yellow bone marrow, on the other hand, is going to be inside the shaft, inside the diaphysis of a long bone only. And that's going to be very nutrient rich because that's going to have fat inside of it. So you've probably heard of a bone marrow transplant before. And a bone marrow transplant is just what it sounds like. You have a donor and they donate some of their bone marrow to a patient. And so what happens is if you have leukemia, leukemia is cancer of the white blood cells. And remember, cancer is uncontrolled mitosis. So what happens is their bone marrow is bad, so to speak. The bone marrow has the mutated white blood cells. So what you do is you irradiate, you give chemotherapy and radiation, and you destroy the bone marrow of the patient because the bone marrow has the cancer cells. Then what you do is if you have a donor, they donate red bone marrow, that gets injected into the patient. Those cells go back into the flat, irregular bones, epiphyses of a long bone, and they start making normal blood cells. So you're cured from a bone marrow transplant. And that's why they do that, because that marrow is going to have all these stem cells as well to keep making more and more of these all of your blood cells, red blood cells, white blood cells, and platelets. So bone is a connective tissue. All connective tissue has a matrix, and the matrix of bone has two things. It has an inorganic and an organic component. Now notice the organic component is called the osteoid, and it's about 35% of bone. By the way, the matrix of bone makes up most of bone. It's like 98-99% of your bone is matrix. So the organic is produced by the osteoblast. Remember that blast means to make something. In this case, it's making bone. So the osteoblasts are making the collagen, and the collagen is organic. It's a protein. It's an organic molecule, and it gives flexibility to bone. So it allows the bone to twist and stretch a little bit and helps make it really strong. Now, the inorganic component is going to be the salts and the minerals, and that's the bulk of your bone. These calcium salts and phosphate salts. So that's why we talk about making sure you get enough calcium, because that calcium is going to literally make your bones dense or strong. So when you've heard of bone density, that's strength from the minerals. And so calcium phosphate is the main mineral. You can see there's some other ones in here, but it reacts with some hydroxide to form technically bone or crystals called hydroxyapatite. And you're not going to ever have to write this, but excuse me, lots of strong, hard minerals. So these are very hard and they're inflexible and they're very, very strong. So they're really good for compression. So if you were to look at bone and look at how perfect it is, the salts are embedded in the organic, in the collagen. And the combination of the collagen fibers and all those salts makes your bones super strong, but they're also flexible. So for example, in this picture down here, if you were to take a bone and soak it in vinegar, all of those calcium phosphate salts would leave, and all you'd be left with is collagen, and you could literally tie it in a knot. However, if you cooked the bone and you cooked all the protein out, you would be left with just the matrix, just those minerals, and it's very, very brittle. So it's really cool how the two together work. So if you remember, and remind me because I often forget, we have some chicken bones that this has been done to, and you can check them out, but just remind me in lab. Now the bone cells is very little of bone itself, and so we looked at the bone cells briefly. We have the osteocyte, that's the mature bone cell, right? And the osteocyte is inside its own little space called the lacuna. Now osteocytes cannot undergo mitosis, and their job is to maintain your bone density and maintain the matrix. Remember that they were all connected by the canaliculi. Those are those little canals to transport blood. Now, the osteoblast, on the other hand, that's the bone maker cell. We say bone deposition. So osteoblasts come from stem cells called osteoprogenitor cells or osteogenic cells. So these are stem cells for osteoblasts. So they're just like your constant supply of them. And osteoblasts make the collagen. They help make the matrix. So they are involved in what we say bone deposition. Whereas osteoclasts, on the other hand, break bone down. So they do osteolysis, and you'll see this word lyse, right, at the end. That means to break down. So they're involved with bone resorption. They're going to break down the matrix. And a lot of times they do this to release calcium. So if you're not getting enough calcium in your diet, remember, you're going to take it out of your bones. And that's what the osteoclasts do. But the osteoclast and the osteoblast also work together to constantly build and break down and build and break down and remodel your bones to keep them nice and strong. If we look at the microscopic anatomy of compact bone, you've seen this before. It's very, very dense. That's why it's called compact bone. It's always found over spongy bone or cancellous bone. You don't want that spongy bone to be exposed. So this is the one that looks kind of like the tree trunk, and it's very strong and provides protection and support. So the basic functional unit is called an osteon, or it's called a Haversian system. So this would be one tree trunk. And if we look at it, we know in the middle is the canal, and you can call it a central canal or Haversian canal. And remember, that's the blood supply. Now, if we look at this, we also know that we have rings of collagen around the canal. So when you see it ending in an E, by the way, that's plural. So lamellae are the collagen rings, plural. One ring would be lamella. But what's kind of cool is you can see how the fibers run in different directions in each ring. So that really helps with that tensile strength and also twisting strength for your bones to be really strong. The lacuna, remember, are the little space around the osteocyte, and they're all interconnected with those little squiggly line-like things called canaliculi. And remember, they're literally tiny canals. So you have a picture in your notes similar to this, and I want you to know the A, B, C, D. It's kind of out of order here, but you can clearly see the Haversian canal or central canal inside. You can see C is having a bracket here so it can point at one of those collagen rings. You can also see that your osteocyte are these little black things, right? The little black dots that you can see as well. Now, when we look at cancellous or spongy bone, it still has lamellae and osteocytes and canaliculi. If we were to cut it, it still looks very similar. However, look at how it's arranged. It's not arranged in these osteons, right? With all these tree trunks really, really dense and really, really strong. If I come back here for a minute, see how these osteons, how they're packed in there? Look at the trabeculae. They form like a network. So they're actually formed of these little beams, and the Latin word for little beam is trabecula. So each of these is a trabecula or a beam or lattice, and if you cut one of these, inside it you'll see that structure. But it's laid out so it has lots of spaces. So there's lots of space for all that red bone marrow. So it provides a little bit of support, but its main function is hemopoiesis. So this concludes our first lecture on the skeletal system.